The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. It was reported last night that patients are being kept overnight at the Cobequid Hospital, a facility that is not equipped to handle such cases. The Cobequid has no kitchen and can't properly nourish patients if they are admitted for longer than a few hours. The site stayed open overnight 11 times in the last month. There is a direct correlation between the problems of offload delays and lack of availability with long waits in emergency departments and the need for overflow facilities, and Nova Scotians know that they need their government to be committed in solving these issues. Mr. Speaker, why doesn't the minister have a plan for fixing the backlog of our emergency rooms?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As I've previously indicated, the work is underway with the Nova Scotia Health Authority, the EHS, the partners who provide that emergency care. Obviously, in terms of the process and the flow of multiple partners, EHS transferring from paramedics into the hospital. There are many steps involved, and Mr. Speaker, work has been ongoing for the last number of months to come up with a recommendation, and I anticipate further information in terms of what steps the NSHA will be taking to improve that flow in very short order.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. That's a good segue, Mr. Speaker, into an article that was published last night. The director of the NSHA's emergency program said that she believes that patients, and I quote, and I'll table that article, are better off remaining in beds than on an ambulance stretcher in the hallway, and I couldn't agree with her more. With visits going up and hospitals clogged with people waiting for long-term care, we need additional resources to deal with the bottleneck that's been caused by this government's refusal to invest in health care, with this government's refusal to invest in long-term care. And I think the one solution, Mr. Speaker, is staring us in the face. Mr. Speaker, I'd like to ask the minister if he will commit today to properly resourcing the Cobequid Health Centre and keep it open 24 hours.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As had been noted previously, both today and in previous sessions of the legislature, looking at the Cobequid centres, we looked at the entire QE2 redevelopment project here in the capital region, looking forward to what and how resources would be deployed. Mr. Speaker, that was part of the questioning. A recommendation did not come in to restructure the status of that particular facility, while it continues to be looked at for services as they continue the details around what services will be offered exactly where. That work is ongoing, and Cobequid is still part of that work within the NSHA and the QE2 redevelopment project team.